Welcome back to the deep dive. You've handed us a really interesting collection this time, research articles, some textbook wisdom, all centered around type 2 diabetes mellitus.
Yeah, T2DM, a topic with a lot going on.
Definitely. So our goal in this deep dive is, well, to extract the most critical insights from these sources, give you a solid and understandable picture of T2DM without getting bogged down in every single detail.
Right. Focus on the core concepts and the practical takeaways.
Exactly. And we're going to uncover some surprising things, like how your own cells might be working against you, even with plenty of insulin around.
And the liver's role.
Yeah.
That's often unexpected, how it can actually push blood sugar higher.
Yeah, and why something seemingly simple like needing the bathroom more often can be such a key early sign. So let's just jump right in. Type 2 diabetes mellitus, what's the absolute core issue here?
Okay, so fundamentally, type 2 diabetes is marked by persistently high blood sugar, that's hyperglycemia. But it's really more than just high glucose. It signals a bigger metabolic imbalance.
An imbalance?
How so? Well, the basic problem is that your body's cells become less responsive to insulin. Insulin is the hormone that should help glucose move from your blood into your cells for energy. But in T2DM, it's like the cells aren't listening properly. Your sources specifically mention muscle, liver, and fat tissues being particularly affected by this resistance.
Okay, so the body's not using insulin effectively. The key isn't quite fitting the lock anymore. But what actually starts this whole process? What's the combination of factors?
It really is a combination. As we said, insulin resistance is a primary driver. The cells get, a bit deaf to insulin signal.
Right.
But what's interesting is that over time, the pancreas, which makes the insulin, might also struggle to keep up. It might not produce enough insulin to overcome that resistance.
So double whammy there.
Exactly. And then there's that twist with the liver. Normally, it helps manage blood sugar. But here, it can actually start producing too much glucose, even when your blood sugar levels are already high.
Wow. So it's adding more sugar when you don't need it.
Precisely. It's like glucose isn't getting into cells efficiently, the body isn't making quite enough insulin to force it in, and the liver is just making the problem worse. Bit of a perfect storm.
That really paints a clearer picture. Not just one thing, but several interconnected issues. And looking at the material you shared, there's a list of risk factors. Some seem pretty common, right? Things many of us might relate to.
Oh, absolutely. Genetics definitely play a role.
Yeah.
If diabetes runs in your family, your risk is higher. Simple as that.
Okay.
Age is another factor. T2DM typically shows up in adulthood, though we are seeing it younger now too. Obesity, particularly extra weight around the abdomen, central obesity, they call it. That's a major risk factor.
Right, the belly fat.
Yeah. And then the lifestyle stuff, lack of regular physical activity, being sedentary, and diet. A diet high in sugars, refined carbs, unhealthy fats. That contributes significantly.
Makes sense.
Plus, if you already have things like high blood pressure, hypertension, or abnormal cholesterol levels, dyslipidemia, those increase your risk too. And a history of gestational diabetes during pregnancy, that's another flag.
So it really sounds like both our genes and our habits are key players here. Now, we talked about insulin resistance. Can we dig a bit deeper into what's happening at the cellular level? How do these cells become resistant? And what other internal processes are going haywire?
Sure. Let's break down those main mechanisms. First, insulin resistance itself. Think of insulin like a key, right? It unlocks doors on your cells so glucose can get in for energy.
Okay.
In T2DM, these doors, especially on muscle, fat, and liver cells, they get harder to open, even if the key, the insulin, is there. Sometimes there's even more insulin early on as the body tries harder.
So the body's shouting louder, but the door is still stuck.
Exactly. It's like the lock mechanism is jammed or changed. So glucose gets stuck in the bloodstream, leading to high blood sugar.
Got it. The insulin's there, maybe even extra, but it's just not working as well. Now, what about the liver again during all the cellular stubbornness?
Right, the liver. It's fascinating.
Yeah.
It stores glucose, but it also makes it. That process is called gluconeogenesis, kind of like a backup sugar factory. Normally, this factory only runs when your sugar supplies are low, like overnight or if you haven't eaten. But in T2DM, it seems like this factory just keeps running, keeps pumping out glucose, even when your blood sugar is already full or even overflowing.
So the liver is missing the memo that says stop making sugar.
Basically, yes. The signals aren't getting through correctly. Then you've got the issue of impaired insulin secretion.
Secretion, so making the insulin.
Yeah. Over time, the pancreas, specifically the beta cells inside it that produce insulin, They can start to struggle. They've been working overtime trying to overcome the resistance, right?
Right, trying to force the glucose into those resistant cells.
And eventually they can get worn out, exhausted, and just can't produce enough insulin to effectively lower blood glucose anymore.
And I think one of the sources mentioned the beta cells themselves can actually get damaged.
Yes, exactly. That's the fourth key mechanism, beta cell dysfunction. Those insulin-producing beta cells can become damaged and gradually lose their ability to secrete enough insulin. Some research even suggests that chronic high glucose itself, the very thing they're fighting, can contribute to wearing them out.
Wow, that's kind of paradoxical.
It is. This decline in beta cell function is a really significant part of how T2DM progresses over time.
Okay, this really clarifies the complex interplay inside the body. Now, moving outwards, what are some of the signs, the symptoms that might suggest these internal changes are happening? What might you, the listener, actually start to notice?
Well, the noticeable symptoms often link directly back to these mechanisms. For instance, that frequent need to urinate polyuria happens because there's so much sugar in your blood. Your kidneys work hard to filter it out, but they pull water along with the sugar into your urine.
Ah, okay. So excess sugar pulls water out.
Right. And all that fluid loss naturally makes you thirsty polydipsia because your body's trying to rehydrate.
Makes sense.
Then, even though there's lots of sugar in the blood, it's not getting into your cells for energy properly. This can make you feel unusually hungry, polyphagia, and also just generally fatigued because your body isn't using as fuel efficiently.
Okay, that makes perfect sense. Trying to flush sugar, getting dehydrated, and cells starving for energy despite high blood sugar. What about blurred vision? That seems a bit different.
Yeah, blurred vision can happen because high blood sugar levels can actually affect the fluid balance in the lens of your eye. It can cause the lens to swell temporarily, changing its shape and messing with your ability to focus.
Huh, interesting.
You might also notice wounds seem to heal more slowly or you get more infections than usual. That's often down to impaired blood circulation. And also, high sugar levels can weaken parts of your immune system. Tingling or numbness, often in hands or feet, that's neuropathy. It develops gradually from nerve damage caused by prolonged high glucose. And finally, recurrent infections, skin infections, UTIs, yeast infections, they can be more common because high sugar creates a good environment for bugs to grow and your body's defenses might be lowered.
These are all really important signals to pay attention to. So if someone suspects T2DM based on these, what are the key tests doctors use to actually diagnose it?
There are several main tests. The fasting blood glucose, or FBG, that measures your blood sugar after you haven't eaten for at least 8 hours. A result of 126 milligrams per deciliter, or MGDL, or higher on 2 separate tests usually indicates diabetes.
Okay, 126 fasting.
Then there's the oral glucose tolerance test, the OGTT. You do a fasting test, then drink a sugary drink, and they check your blood sugar again 2 hours later. If it's 200 mg/dL or higher at that 2-hour mark, that suggests diabetes.
Right, the sugar drink test.
There's also the hemoglobin A1C, or HbA1c. This one's really useful because it gives an average picture of your blood sugar control over the last 2 to 3 months. It measures how much glucose is attached to your red blood cells. An A1C of 6.5% or higher is diagnostic.
So that gives a longer term view, not just a snapshot.
Exactly. And finally, a random blood glucose test. This can be done anytime, doesn't matter when you last ate. If the result is 200 milli-GDL or higher, and you have those classic symptoms of high blood sugar we talked about, that can also point to diabetes.
Okay, so it's a combination, checking current levels, sometimes after fasting or a sugar load, and getting that longer term A1C average. Now let's shift gears. Say you, the listener, get a T2DM diagnosis. What are the main ways to manage it, to live well with it?
Yeah, managing T2DM effectively really means taking proactive control. And the foundation almost always starts with lifestyle modifications.
Diet and exercise, right.
Absolutely. Making thoughtful dietary changes is huge. Focusing on a balanced intake, foods with a lower glycemic index, meaning they don't spike your blood sugar as much, healthy fats, lean proteins, lots of fiber, and weight loss, even just a modest amount, can seriously improve insulin sensitivity.
So losing even a bit of weight can help those cell doors open easier.
It really can. And regular physical activity is the other cornerstone. It doesn't just help with weight. Exercise itself directly helps your muscles use glucose better and improves your body's overall response to insulin. Think of it as like manually helping unlock those cell doors.
Okay, so diet and exercise are front and center, especially for improving how the body uses its own insulin. What about medications? The sources you gave listed quite a few types.
Yes, medications often become a necessary part of the plan to help get blood glucose levels under control. Metformin is usually the first one doctors try. It mainly works by reducing how much glucose your liver makes and by making your body's tissues more sensitive to insulin.
Okay, the common first step.
Then you have drugs like sulfonylureas. These basically stimulate your pancreas to release more insulin. DPP-4 inhibitors work a bit differently. They help your body release more insulin after meals by boosting a natural hormone. SGLT2 inhibitors are interesting. They work in the kidneys, making you excrete more glucose through your urine.
So they help you pee out the extra sugar.
Essentially, yes.
Yeah.
GLP-1 agonists are another class. They increase insulin, reduce a hormone called glucagon, which raises blood sugar, and they often help with weight loss too, which is a bonus.
Right.
And finally, if other meds aren't enough, or as the disease progresses, insulin therapy itself might be needed. Just supplementing the insulin your body isn't making enough of.
Wow. Okay. So there's quite an arsenal of tools, each tackling the problem from a slightly different angle. Once a plan with lifestyle and maybe meds is in place, what does the ongoing monitoring and care look like?
Consistent monitoring is absolutely key. Often, this means regular self-monitoring of blood glucose at home with a meter. Checking levels at different times fasting, before meals, after meals, helps you and your doctor see how well the plan is working.
So keeping track day to day.
Yes, but it's broader than just blood sugar. Because people with T2DM have a higher risk of heart problems, it's crucial to also monitor and manage blood pressure and cholesterol levels. They often go hand in hand.
Right, managing the whole cardiovascular picture.
Exactly. And managing any other health conditions. You might have comorbidities, they're called. It's really about a holistic approach to your health.
Makes sense. It's not just about the glucose number, but the bigger health picture to prevent future issues. And speaking of future issues, the sources do highlight some pretty serious long-term complications if T2DM isn't managed well. What are the main risks our listeners should be aware of?
Yeah, unfortunately, unmanaged or poorly managed T2DM over time can lead to significant problems. Cardiovascular disease is a huge one, much higher risk of heart attack, stroke, and peripheral artery disease, which is poor circulation in the legs and feet.
Okay, heart and circulation are major concerns.
Definitely. Nerve damage neuropathy is also very common, especially in the feet and legs. It can cause pain, tingling, numbness, and because you might lose sensation, you might not notice injuries, which can lead to infections and serious foot problems.
Yeah, for foot issues.
Eye damage or retinopathy is another risk. High blood sugar damages the tiny blood vessels in the back of the eye, the retina. Left untreated, it can lead to vision loss and even blindness.
Wow.
Kidney disease nephropathy is also a major complication. The kidneys get damaged trying to filter all that excess sugar, and over time, this can lead to kidney failure, needing dialysis or a transplant.
So eyes and kidneys are vulnerable too.
Very much so. And those foot problems we mentioned, resulting from poor circulation and nerve damage, they can become so severe that amputations might become necessary in worst case scenarios. And lastly, just generally, chronic high blood sugar weakens the immune system, making you more prone to all sorts of infections.
Gosh, those are certainly serious consequences. Really underscores why proactive management is so vital. So, to wrap up our deep dive into the info you shared on type 2 diabetes, what are the absolute key takeaways for our listener to hold on to?
I'd say the most important points are T2DM involves your body resisting insulin, often combined with the pancreas not making enough insulin and the liver overproducing glucose. It's a complex metabolic issue.
Right, the resistance, production, and liver issues.
Yes, and if it's not managed well, it can lead to serious long-term damage to your heart, nerves, eyes, kidneys, and feet. But, and this is the crucial part, early diagnosis and consistent management through lifestyle changes, plus medication when needed, make a huge difference in reducing those risks and maintaining a good quality of life.
So understanding what's happening, knowing the risks and signs, and taking action with lifestyle and medical care are absolutely fundamental. This has been really insightful, breaking it all down, thinking about all these interconnected systems, muscles, liver, pancreas, kidneys, eyes. It makes you wonder, what other areas of overall health might be significantly affected by metabolic conditions like T2DM that maybe we didn't even touch on today?
That's a great question. Things like brain health, cognitive function, even susceptibility to certain cancers. The links are being explored more and more. It really shows how central metabolic health is to, well, everything.
Absolutely. It truly highlights how these fundamental processes ripple outwards, impacting overall well-being in ways we're still fully understanding. Something definitely worth pondering.